It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Welcome back. Our first guest, and of course, we've mentioned this is the COVID era, and our first guest is going to address that. Dr. Teresa Girolami, Shannon, COVID-19. We need to know all that we can know.
Yeah, we're excited to have Dr. Girolami on. She was actually on television early on doing a program called Myths of COVID, I think it was called. This is back in March, and I'm excited to talk to her and see where we are today.
Here's Shannon O'Kelly and Dr. Girolami on Como.
Dr. Girolami, thank you for joining us here on Health Talk. How are you?
I'm great. Thank you so much for having me.
Well, thanks for joining us. I'm excited to talk a little bit. Let's just back up a little bit, a little history here. Last time I saw you, you were on one of the TV stations. I think this was early March, and you had come out, did a great job, by the way, fantastic job.
Thank you.
You were talking about COVID and this whole virus, and that was early on in the virus. And I want to kind of talk about what we know, what we knew then and what we know now. But before we get into this, tell us about your background, your practice, et cetera, the day in the life of your practice.
Great. Thank you. I'm a board certified internist. I have a private practice. So it's myself and my nurse practitioner, Cheryl Allen. We practice out of the East Side. I've been doing that for the last 25 years. I grew up in Tacoma, so I'm a local girl, and went to school at the University of Washington, trained in New York and then Chicago. So I have a lot of experience around the country. I also was an ER doc for one of those years in Chicago. That was quite exciting. And I do all kinds of things in my practice. Primary care, I do physicals, travel medicine, diabetes, high blood pressure, physicals, men's health, women's health, biopsies. I'm kind of old fashioned. I can do everything still. I grew up with no computer. And so I could do a scope. I could do a biopsy. I can do breathing treatments. I can do all kinds of sew you up if you get a cut or an injury. And then a lot of mental health. And that's been interesting in this COVID time.
Absolutely.
So.
You're also, politically, you're involved a little bit too. You're involved with some associations.
Yes.
So you're kind of in the know, so to speak. So tell us about your involvement in some of those associations.
Yes. I am the immediate past president in the King County Medical Society, and we represent most of the physicians in Washington State. And then I'm on the kind of the little political action committee of it right now. So that's been very interesting. And then I'm also a board member for the Washington State Medical Association. And we do a lot of different things there as well. And our big meeting's coming up, of which we'll be talking about a lot of the issues going on right now in our community, involving everything. In the King County Medical Society, we deal with the residents and the medical students. And so their issues are very interesting and the things they think are important in their lives. And then we have the employed physicians. I'm on staff at Evergreen and Overlake. And as you know, Evergreen was the epicenter for the COVID in the whole United States. So this is an interesting fact. I get an email every single week from Evergreen telling me how many people have died and how many people are admitted. And this is some really great news that I think people should know. Right now, currently in Evergreen, there's only 8 people admitted with COVID.
That's great news.
So that is great news.
You know, and that's part of you. First of all, you're a busy person. Wow, you do a lot of stuff and have a ton of experience, obviously. And then going back to these early days, you know, the first case of COVID was diagnosed and treated right here at Providence in Everett. And, you know, those were the early stages and the early days. You know, I just want someone, and I think the public just wants someone to tell us what is going on. You know, I mean, you can read one thing and then get to another magazine. It's another thing. I mean, there's a lot of fear. We should take this serious. We have to take it serious. I get that. But what do we know then and what do we know now? Sounds like only 8 people in the hospital. Are we treating them better, diagnosing them better? What's going on?
That is a great question. And you went back to when I was on the TV station. That was very early March.
Yes, it was.
And I had just gotten off a plane. And I had already been thinking in my mind about it because my husband... Sorry, honey, I'm throwing you under the bus here, was a little paranoid. And he was watching Italy. And he said, if Italy didn't manage it, we were going to have a problem here. I said, it's coronavirus. It's been around since the beginning of time. Just don't worry about it. You know, it'll do its curve. We'll be all right. And I was thinking that way. So on the TV station way early March, I was saying, just be reasonable. You know, cough in your shoulder, your arm or your sleeve. Don't go to school if you're sick. Don't go to work if you're sick. Go outside, get fresh air, try to stay healthy. I would say all those same things now.
Back with Shannon O'Kelly and Dr. Teresa Girolami right after this on KOMO.
It's a Northwest Lifestyle Weekend on KOMO News. Now back to IRG's Health Talk.
We continue our conversation with Dr. Teresa Girolami and Shannon O'Kelly.
Dr. Girolami, thank you for joining us again. Great stuff, great experience. We just ended the last segment. You were talking about, I think you said your husband was a little bit concerned and you were like talking, hey, this is just going to be kind of a normal influenza. Just be careful, do the precautions that we've always done and should do. Boy, that's different, isn't it?
The interesting thing is you mentioned earlier about the media and the different information we're getting. And I go on a call on Fridays with the infectious disease from Evergreen or Overlake. And the interesting thing is I brought up a point of how are you diagnosing these patients? How are you putting the code on them? Are you getting paid more if you put COVID on there? Why does everybody have COVID now when a lung cancer person died and you counted that as a COVID death?
Mm-hmm.
I said, I don't think that's right. That should go in the lung cancer category.
Mm-hmm.
Well, we have changed now. So here's some really great news also. All those early deaths in the COVID category are now being looked at. So our death rate has dropped to 2.6%. So a lot of those people really didn't die of COVID. It was just an incidental finding. So my mother has metastatic lung cancer. She's doing great, but she's in hospice. If I breathe on her wrong, she's probably going to not do well.
Mm-hmm.
Doesn't matter if it was COVID or influenza or what the virus was. And she shouldn't go into the COVID category. Wouldn't be her main reason why she died.
Right.
So we've changed that. So the number has dropped dramatically. So I want to just say some really great news. You should go to the doctor. Don't be afraid to go to the doctor.
Mm-hmm.
You need to stay well. You need your diabetes controlled. You need your blood pressure controlled. Not going to the doctor for fear is the wrong thing to do. The anxiety level is so high. I just want people to know you're going to be okay if you go to the doctors. They got every precaution under the sun in there. They've always have probably. Go there, stay well, go outside, get fresh air, get sunshine. You need to stay well.
What is the sequence? I think I read something the other day that the sequence for COVID to determine COVID versus influenza is most people will start with a temperature and then they get the body aches.
That is classic. When someone says, I have a temperature of 103 and I feel like I'm achy all over and can't get out of bed, I always think flu first.
Okay.
Always.
Okay.
I can honestly say over 98% of my population has not had COVID. And if you look at the data, 95% or higher in this state, those tests are negative. You have a 95% chance you're never going to get it. And if you're in that poor little 5%, you have a 2.6% chance you're going to die. I would go to Vegas with those odds any day.
I need some good news. You know what I'm saying?
Yeah.
Let's keep it rolling. So, we got to take it serious. I mean, we've got to wear masks. We've got to social distance. Do you have any idea? I mean, I'm going to ask you to look in your crystal ball just because you have so much experience. When is this going to end or when are we going to get through this? I'm excited to get through it. I know we will, but do you think this is going to happen?
I think really in the real world, this has been around for a long time. Maybe we've not been able to identify it. There's always going to be coronavirus somewhere. Mm-hmm. I think we are doing awesome. I can't answer your question about are we better at it? Obviously, we're going to get better. This is the United States. We are an awesome country. We are going to find a way to manage it, and we are going to get a vaccine.
Wow. I'm excited. I'm so pumped for the day. I'm going to go out there and shout to the stars. We're okay because we are okay. You're exactly right. Thank you for joining us.
Thank you very much.
Very informative and informational from Dr. Teresa Girolami, a board-certified internal medicine specialist and primary care medicine for 20 years on the east side. And Shannon, of course, we need to get all the information we can on this COVID-19. The better informed we are, the better chance we have to stay safe.
That's exactly right, Tom. And I really appreciated Dr. Girolami. I mean, being so positive and giving us good news, better news than we've often seen in the media. I just want people to tell us exactly what's going on. You know what I mean?
Yeah, absolutely. Well, our next guest, Dr. Samuel Galley, right after this on KOMO.